So welcome everyone. Today we will be practicing what is known as a functional breath. And functional breath is something that it means breath functions well. And what is the importance of that? The importance of that is that it functions so that proper oxygenation happens. Now, what is oxygenation? People always think about oxygenation as what you take in amount of air. Is that oxygenation? If you get enough air, yes, you need enough air to get good oxygen. But enough air does not mean oxygenation. Expansion of chest, expansion of breath, expansion of clear nose, belly moving, all these things. Does that mean oxygenation? No. If you put on the oximeter and if you have oxygen concentration, which is 90%, 80, 90% or more, 95, 100%, is that oxygenation? No. Believe it or not, that is not oxygenation. What is oxygenation? This is an interesting question. And this is what functional breathing is all about. Oxygenation is what the cells get oxygen. How much of the cellular level, not in the blood level. This is a major misconception that people carry. If you carry with the idea that, oh, my oxygen concentration is 95%, so I'm doing fine. Wrong. Yes, it is required to get to that level. But how much of oxygen do the cells get? That depends upon a number of other factors. How many RBCs do you have? Supposing you have very less number of RBC red cells. Supposing you are anemic, suppose your hemoglobin is low. Supposing the RBCs are not normal. Spherocytosis, there are a few other conditions like that. Sickle cell, anemia, stuff like that. You have changes in the morphology of the RBCs. What if 99% oxygenation in the blood had no meaning? And so recognize that there are, and then of course circulation. If a circulation, in a cold season, it doesn't happen here where I'm in Houston, but when it's cold, very cold outside, all the circulation shrinks. And then despite having 99% oxygenation, your fingers may have frostbite. Nose may have frostbite. Why? Because there's not enough oxygen. And so recognize that oxygenation is at a cellular level. This is the most important idea that we have to sort of think about whenever we breathe, whenever we, does the oxygen reach the area and properly in the same amount? And do the cells actually extract the oxygen? Now, having said that, what are the things that help the extraction of the oxygen in the cell? And that's interesting. Number one, obviously, is the fact that it has to require the proper circulation. It has to require cell being normal. The abnormal cells are there. For example, cells are sick, one reason or the other. Cells are not functioning. Liver cells, for example, damaged by alcohol is an example. Or kidney cells. If the cells themselves are not normal, they will not have proper absorption. Let's say in a normal individual, what happens? In a normal individual, cells will extract oxygen because their metabolism is working. Once they start working on metabolism, their internal oxygen level goes down, internal carbon dioxide level goes up. And so now there is an imbalance. So when the circulation comes, there's an exchange that happens. Simple concept. And that is fine. But what is helpful here, one of the most important things that was not recognized as easily was the fact that the pH of the blood or amount of acid or base within the system determines significantly how much of oxygen is given to the cells, how much of oxygen cells take. They call it oxygen dissociation curve. We don't go into details of that, but it's simple to say that as you have more and more carbon dioxide level go up, or the pH of the level blood starts falling, acidic, the more excited the cells are to get more. It's much more like when you have a hurricane or a snow emergency. What happens to us is even if I open my closet, or pantry, even if I have enough food in there, I feel my food is not going to be enough. I can run out and fill up my food stores. For the toilet tissues and milk and all that stuff, I have to get all that supplies. And so this perceived uh, deficit is an important thing. Perception of deficit or actual deficit of not enough oxygen or more carbon dioxide. So there are two concepts. I'm going to use two terms here. And we're going to move on very quickly to it. And one is called hypoxia, low oxygen. And actual oxygen is not there. And the second one is called hypercapnia or hypercarbia, where the CO2 level is higher. When you have this, the extraction, that curve that we're talking about, oxygen dissociation curve, is like an S curve. It moves in a direction where the cells are really hungry. If you're hungry, you tend to eat a lot more, isn't it? All of a sudden, a hungry person is given, you clean up the whole plate. While the cells really extract a lot of oxygen at that point. They learn how to do that. The cells have to learn how to survive at the low oxygen level. So this is a very important thing. And is hypoxia good or bad? Interesting question. Hypoxia may be not good if it is long time continuous hypoxia, because the cells will start having not enough oxygen. But a temporary hypoxia, a temporary high CO2 level, trains the cells. Very important concept. It's much more like if you have a social security that is coming to you, and they say, okay, this month, starting next month, you will get not $1,000 a month, but $800 a month. So you say, oh my goodness, what's going to happen? Initially, you may have trouble, but then gradually what happens is, okay, well, I learned to live with 800. The following year, they say, we're going to cut it down to 700. Now what? You learn the mechanism how to survive at 7 or 500. So as we learn how to adapt, it's called adaptation. As we learn to live at a little bit different level, our body and our mind and our system trains itself to adapt, to build up the resilience, to build up the capacity to survive at a lower supply level. This happens in our country, third world countries, all the time. Children, they live at a much lower amount of food. It's not normal. They can have issues. They can get disease. They can get sick. It's not a normal thing for a long term to have that. But as I said, temporary, short term is a training technique. In fact, we do that all the time. Where do we do that? In all the gyms. Gyms also, when we walk around and we do all this stuff, we push ourselves to get tired. That's one of the techniques. So I just wanted to introduce the concept about the hypoxia, hypercarbia as a training tool. Now, where is it applicable? I'll mention that, and then we'll go to the next section. But where is it useful? It's useful for a number of reasons. Number one, a normal individual, they learn how to survive even if the oxygen is low. Like, for example, if you go, exercise a little bit, And your exercise, you get short of breath and you get all that. Now, your exercise tolerance will increase if you know how to handle the low oxygen tension. First of all, you need to know that there is low oxygen tension, but you're normal, etc. And then you can build up on it. But exercise tolerance build up can be done if you know how to breathe well, how to breathe functionally, and also create hypoxia, hypercarbia. If you learn how to do this, you will be able to exercise a lot more. Your functional capacity will be a lot more. Oh, I get tired. No, you will learn how not to get tired. So that's why it's a very important learning for any training. Strength and endurance, two things will be changed significantly. Power, strength, and endurance. And that includes balance. So if you include a balance, then the breathing practice will also balance. So that's one area, exercise. Second area, which is important, is if you're sick. When you're sick, and if you're having fever, if you're having some chronic illnesses, heart disease, cancer, stuff like that, you start learning how to do this, how to handle, because your immune system needs a little bit boost. Immune system also gets very excited about this. So that's the second area. The third area is normal physiological. When you do just exercise, you go to high altitudes. When you travel up a little bit mountain, you go hiking, you go up higher level above the sea level, the oxygen pressure reduces, outside pressure. And so the outside pressure is low, the inside pressure will be low too. High altitude. And high altitude now is a problem because you're not used to it. You're not used to that less oxygen supply. Remember, we were talking about that amount of oxygen coming in, how much the red cells carrying, etc. And so, so you have a situation in high altitude training. Now, the next one is very important, and that is equally important. That means when all the athletes, athletic training, and you notice athletic training, that is very helpful. They go into space training, for example, those kind of things, or diving underneath the sea, diving and swimming, scuba diving, whatever diving you're talking about. These are all the things where the pressure is different and the amount of oxygen is less. So there are a number of advantages. We'll talk more about this after we do some practices in the next section.